I'm Sean Lim, and welcome to After 10. Here in Korea, seeing a doctor can be as easy as walking into a clinic without an appointment. But can this fast service, fast treatment model find a home overseas? On today's After 10, we meet a doctor who's bringing convenience healthcare to the United States. Stay with us. Well, Dr. Lee, thank you so much for joining us here tonight on After 10.
Thank you for having me.
So, Dr. Lee, you spent your childhood here in Korea, you got your medical training here in Korea, and now you're in the States and you have this medical practice called HELLOMED Convenience Clinic. Can you tell us more about this convenience model and why you decided to go to the United States to settle a medical practice?
Okay, during my career in Korea, I participated in decision-making process for the hospital management as a medical director over 7 years and contribute to the growth of the hospital to become one of the best in Korea. However, during those days, I recognized need for structured business management training. So I took my sabbatical year to study MBA at the University of Michigan. During my MBA course, I also studied U.S. healthcare system at School of Public Health. This knowledge and my personal experience having hard time to navigate U.S. healthcare system as a foreigner motivated me to think about the interest and potential application of a convenient Korean hospital system to U.S. hospital system.
Before we get into more of the details of the Korean system that you're bringing over to the States, what are the issues with the U.S. healthcare system?
So first of all, accessibility is lacking and long waiting time, especially primary care. There isn't enough primary care personnel. The implementation of Obamacare is going to aggravate the shortage. So this impacts those with insurance as well. For uninsured, those without insurance, as you know, that high healthcare cost is the problem. Also, I felt customer service provided U.S. healthcare system is lacking compared to Korean hospital system. Finally, the healthcare service provided at primary care institution lacks of unity, is fragmented. That's the problem, I think.
Can you tell us a little bit more about how the Korean system can solve some of those issues?
When you look at the American system, patients with a sudden and acute illness, there's a few options where you can visit without a prior reservation. Only thing is the emergency room, urgent care center, and retail clinic, and so on. Emergency rooms, those are like in Korea system. Urgent care system, urgent care center, unlike emergency room, they accommodate minor acute illness. They don't accommodate a severe life-threatening patient. But they open early morning to late evening. Also take care, also treating a trauma, the injury, broken bone, etc. Retail clinic, it is the fastest growing medical service provision in United States. It is staffed by nurse practitioners or physician therapists, physician assistants actually. They are situated in large pharmaceutical pharmacies, or like a CVS or a Walgreens, or a large grocery superstore. they're also treating minor illness, minor injury or sort of physical exam. That is the US part. When you look at the Korean side, all primary care is really great quality. We can access the primary care all over the city, walkable distance. The unique feature of Korean primary care is almost all primary care is done by specialists. Basically, special doctors see the primary care and adding value with their specialty, like a physiotherapy or something, healthcare checkup, something like that. So all things considered, I think there's a market opportunity in United States primary care sector. We have a comparative advantage in Korean primary care sector compared to big university hospital. So I think it will be interesting to adopt primary care of Korea to U.S. healthcare system. This is, really big market.
So do you fall under the retail clinic category?
Yeah. Right. Basically, our system take after retail clinic in terms of service, range of service and staffing model. But a unique feature of our clinic is we have physicians on board to oversee quality of service provided at clinic. Also, they practice medical procedures as well. We are basically neighborhood clinic. We are situated in street mall shopping area to maximize the accessibility. So that is the unique part of I bringing a Korean system to U.S. healthcare system.
So did you get your medical license in the U.S. on top of a license here in Korea? How hard was it for you to establish a Korean medical center in the United States?
I thought about taking tests while I'm pursuing MBA program, but my original plan is to manage a hospital. So I just start the business to manage the hospital to save time. But some states allow, not all states allow it, but some states allow opening the business, only manage the hospital without practicing medicine.
So you are more on the business side now, and you have a staff of doctors and nurses.
Right.
And do you train them is there a special Korean hospital technique or a standard of operating procedures?
So basically, our medical staffs are all non-Korean. So I take into consideration their sort of ability to accommodate patients with diverse cultural background when I hire them. And then we're trying to adopt a sort of a multicultural environment by hiring sort of a Chinese office manager, something like that. So we are making a really diverse multicultural environment at our office.
So do you feel that there are many minorities in the United States who have lack of access to primary care, and that's why you're focusing on creating a comfortable environment for them?
Yeah, that's true. Basically, access issue not for those people without insurance. Even with the insurance, such as Asian student like me, we had a hard time to navigate the U.S. healthcare system because we are not used to U.S. culture, U.S. healthcare system. So medically underserved population, that is our focus.
So how many patients visit you?
Fortunately, we are getting more patients month by month. And then we expect a lot of business upcoming flu and school season, but it is still insufficient because in U.S. people are conservative side when using medical service. Most of them rely on referral in many cases. I had the opportunity to study at the University of Michigan Ross Business School. So during my school days, I made some connection and then formed a regional network. But referral network is not sufficient, so we started really low. We are still concentrating on advertising our business.
So how have patients who have visited you responded to the service? Do they even know that you're operating under a different model that's imported from Korea?
Some people know, some people do not know, but they really appreciate the service we are providing in terms of affordable rate and good location, accessible location, and convenient, no waiting time, definitely.
So you've experienced both healthcare systems. Can you give us an example of like a person with the flu who has no appointment, just walking into your clinic or a Korean clinic versus one of the solutions that are available right now in the United States?
If you have a flu, you have a couple of options here. You go to urgent care center or emergency room, but issue is cost. If you go to emergency room with flu, we have to pay a lot of money.
Like that, in the hundreds or thousands of dollars?
Right, co-payment or deductible or something like that, depending on what kind of insurance you have. But when the patient come to our clinic, we just charge, really affordable rate. We are focusing on sort of aftercare. When our customer visited our clinic, we're trying to offer sort of a personalized aftercare service. If you say, you just take an example about the flu case, when they just come to our clinic and then they get the treatment at our clinic, when they go back, we provide some mask. If a patient come to treat their urinary tract infection, we provide any kind of food which is helpful to prevent and treat a urinary tract infection, something like that. So basically, we are trying to provide a personalized customer service and then customer retention. In the future, we are trying to adopt developed IT system of Korea to develop the sort of customer retention program.
So what about the IT technology in the medical field that you see in Korea is attractive to you and something that you wish you could take over right away?
Let's take an example. When you get the healthcare checkup in hospital, after 1 year, this is time you have to have an annual checkup. You can text, the system automatically text, now is the time you check up your healthcare status or something.
The Korean system is based on the Korean national healthcare system, but as you said, in the United States, it's a private model. There's a lot of different options to wade through, and now there's the Obamacare program. How has that impacted the level of service that you're able to provide?
Basically, we are expecting a lot of business opportunity with the implementation of Obamacare because as we get many insured population in this area, anyway, they have to use primary care at the first line of their healthcare checkup. So, and then overall healthcare cost will be decreased with that Affordable Care Act.
So are there any problems that you see with medical fees in the United States?
There's a lot of issue in terms of insurance. Basically, insurance system is really complicated. Fundamentally, it's really different from Korean healthcare system. Fundamentally, their system is primary sector. So each insurance payer have their own policy, contract, term and condition, and then charging procedure. So it's really complicated to work with them. So that kind of complicated administration, along with high salary level, is the reason why U.S. healthcare system is, through the roof in these days. So that is a really important part in U.S. healthcare system.
So how do you counter that effect? It sounds like a horrendous situation.
So my idea is Korean healthcare system, U.S. healthcare system, there's a pros and cons of both systems. So, comprehensive evidence-based procedure and then protocol, really fundamental consideration about the patient's safety and long treatment time is the advantage of a U.S. healthcare system. On the other hand, efficient and cost-effective, really patient-centered and responsive procedures are advantage of Korean healthcare system. So I think we need to incorporate advantage of both systems. At the same time, we need to improve lacking aspect of both systems. So meeting in halfway may potentially result in sort of successful and unique business model that I'm seeking to build by establishing the hospital in U.S.
Are you one of the pioneers in this field? Do you see other of your other peers go this same route?
As far as I know, I'm the first doing this kind of business in U.S. I'm not comfortable now because of so we are just starting up, even though we are getting more patient. But in the long run, I think I know this is kind of a too ambitious plan. Now I'd like to lead my clinics, first clinics, stability and then success. For this, I want to try to adopt unique feature of a Korean system, like adopting ancillary specialized service like a physical therapy or healthcare checkup system. If I make a successful business through our first clinic, we want to open branch clinics around the adjacent area of Michigan and then adjacent states. In the long run, I want to expand my business to other countries like China.
So what brought you to Korea this time?
My staying in Korea, has been unexpectedly long, but I'm trying to use this opportunity to see and experience primary care workflow and state in Korea. Also, I'm trying to learn about sort of IT technology which incorporated to hospital management.
What's your opinion on the medical Hallyu, where people from abroad go specifically to Korea for treatment? And whatever value that they get out of that here, do you think that value can actually be transported abroad?
I think basically medical services are specific to each country. Since technology, and not only technology, but cultural and then societal analysis is required to understand. Understanding is really important for the medical field. We have to consider sort of a unique feature of medical service, not only for the technological aspect, but cultural and then societal aspect. So when we export our Korean healthcare system, I don't think we can compete U.S. healthcare system with the scale of business. We have to figure out what is our strengths. At the same time, we have to see potential market niche. We have to spot niche by observing potential market in United States.
So if other people would like to follow in your footsteps and establish themselves in the United States, what kind of advice would you have for them?
As you know, and then as I mentioned before, we have to consider, I think that only the technology is the question about for medical service anymore. So federal law, state law, insurance and culture, societal environment, and medical usage rate are all components you need to understood to the business to be successful. So it is not enough to have just a capital. So we have to prepare a lot. Careful and long preparation is needed.
What's the greatest lesson you learned about working with American patients in terms of adjusting to this different culture?
Well, I'm still learning about things, not only for insurance and administrative things. We have to follow the protocol. That is the system. We have to learn from the United States healthcare system. Really strict protocol, and then fundamental, put a top priority on fundamentals. So if we combine that strengths of U.S. healthcare system and efficient and speedy Korean system, we can find some ideal system in the future.
What do your Korean colleagues always want to ask you after you come back and visit?
They're just asking about why you start the business in the United States. You are a specialty in Korea. I'm a neurology physician. I have a stable work environment, but I really enjoyed a startup. I have basically have a spirit of entrepreneur. So I really enjoyed this kind of work. So.
All right. Well, best of luck to you, and hopefully this new Korean system will really take off in the United States. Thanks so much for joining us tonight.
Thank you for having me again.
And that does it for us tonight on After 10. Thanks so much for joining us. We'll see you again next time. We will continue to do our best to improve our show based on the perspective of our viewers. Always feel free to leave us any comments, great ideas, or suggestions you wish to share with us.